Hi, I'm Dr. Thomas Bobrowski from InStride Crystal Coast Podiatry. Today we're going to talk about what causes an ingrown toenail. Most patients think it's a result of improper nail cutting, but the majority of the time this condition is a result of an inherited nail shape, previous trauma, fungal infection, or chronic pressure and irritation from shoes. Patients will usually treat this condition for many years with painful bathroom surgery, or they will seek the assistance of a pedicurist who digs the nail out. We offer a simple permanent solution for this condition using local anesthesia. The ingrown portion of the nail is removed. This changes the shape of the nail and prevents it from growing in, alleviating the need for those monthly torture sessions. Unfortunately, many patients are unaware of this simple procedure and continue to struggle and suffer unnecessarily with ingrown toenails. You should always seek professional treatment for ingrown toenail if you are diabetic, have peripheral vascular disease, neuropathy, or other medical conditions that increase your risk for developing a more serious condition, or if you notice redness, swelling, and drainage, which are all signs of an infection. If you have a mild ingrown and do not have any complicating medical conditions or infection, you can try alleviating the symptoms by soaking in warm Epsom salts a few times a day and wearing open-toed or roomy shoes. If the pain persists, gets worse, or if you are just tired of those painful monthly bathroom surgeries, give us a call and set up an appointment. As a podiatrist, I can provide immediate permanent relief of your ingrown nail, with most patients returning to normal activities within 24 hours and high-intensity sports and exercise within 1 week. Remember, at Crystal Coast Podiatry, we are dedicated to maintaining your mobility and active lifestyle. Thank you.